New Republican response this morning as well on the Supreme Court upholding President Obama's health care reform law. Senator John Barrasso delivered the GOP's weekly address. Take a listen.
The president and his allies in Congress are going to try to convince the public that the Supreme Court just gave the health care law a seal of approval. The fact is that this is the same failed policy that won't lower the cost of health care in America.
Now, these are just the latest in a slew of talking points from both sides of the aisle, but do the facts uphold the claims that we've heard so far? As you saw right there, joining us today is Emily Ethridge, healthcare writer for CQ Roll Call. Good morning to you.
Morning.
Emily, let's start with this one as we talk about fact or fiction. Here's the first claim that we've been seeing in the news. Everyone will pay a tax for the health care law. When we hear that, what's the verdict?
That's complete fiction. The only people who will be paying a tax under this law are the people who don't have health insurance. And even then, not all of them. Some people who are the poorest, who maybe don't qualify or have just really low incomes, they won't be paying that tax either. So it's not a tax that's going to be levied on every single American. If you have health insurance, you're good.
You know, in addition to this, we've heard from Mitt Romney. He's been making this point several times, at least in all of his public appearances, that the health care law will take $500 billion out of the Medicare budget.
We hear that a lot from Republicans, both Mitt Romney and Republicans in Congress. That's also a fiction. The $500 billion figure comes from, it's actually a decrease in future Medicare spending growth. So over the next few years, all of that spending growth we'll see in Medicare, it's going to continue to rise, but it's going to rise by less than it was without this law. So that $500 billion is really in future spending that we haven't seen yet. And it really doesn't come from benefits that Medicare beneficiaries have. It more comes from providers and other things like that. So it's not that your Medicare is suddenly getting slashed by this law. It's a fiction.
And of course, many senior citizens watching that one. President Obama has made this point several times. He said millions of Americans will receive rebate checks from their insurance company this summer.
That would also be really nice. I think we'd all like to see some checks in the mail. It's also, unfortunately, a fiction. There are about 13 million Americans who are going to get some sort of rebates from these insurance companies, but it's the policyholders that get the rebates. For a lot of us, that's not us, that's our employers. And our employers will get those rebates. They might pass it on to you. They might invest it in some other way. Even if you are a policyholder who gets this rebate yourself, you might not get the check. You might have it applied to future premiums, so your premiums later will be lower. So don't stand by your mailbox and wait for that check quite yet.
All right, I won't do that then. We've heard this too. There's a lot of threats coming from conservatives about the so-called death panels, otherwise known as the Independent Payment Advisory Board. Now, it's a big one, certainly. The advisory board will not decide what health care you receive. Is that true or false?
That's true. There's a line in the law. You hear a lot about this law will ration care. The law actually says in the text of the law, the IPAB, the payment board, cannot ration care. It can't cut benefits for Medicare. It can't change the eligibility for Medicare. It's really restricted. Its goal is to reduce the spending growth in Medicare. So it's supposed to save some money, but it can't do it by rationing care. It can't do it by saying your doctor can't provide you these services. No death panels. No death panels.
You know, the health care law will add to the deficit in the long run. That has also been an argument being made.
Yes, and that's because this is a really expensive law, but, you know, it costs a lot of money, but it also has a lot of savings provisions. So actually, the Congressional Budget Office, which is a nonpartisan group, finds that this law is going to save $210 billion over the next 10 years. So it actually saves money. It reduces the deficit over the long term. It doesn't add to it.
Okay, fact or fiction. Thank you so much. Appreciate the time today. Emily Ethridge from CQ Roll Call on this Saturday.
Thank you.
All righty. A new poll shows